Good evening, everybody. First of all, I would like to thank Dr. Umesh Khanna for providing me this opportunity, and I thank my teachers here, Dr. Hassan, Dr. Tukaram. They have handheld me into nephrology, and Dr. Tukaram has, with him, association has gone further. We have been working on some publications as well. So with this, so learning objectives of today's talk. By the end of the talk, all of us should be able to appraise the systematic review and meta-analysis. In that, we should be able to assess the credibility of the review process and evaluate confidence in the effect estimate and categorize the evidence which we read into high, moderate or low quality. Now, if you look at up-to-date or clinical practice guidelines for KDIGO, they mention some recommendations and some suggestions as 1A, 1B and 1C. So recommendations will be 1 and suggestions will be as 2. And then in front of that there is a word A, B, C. Now A refers to high, B refers to moderate and C refers to low quality. Now how this is done, that we'll be looking into. By the end of this talk, you should be easily able to do this categorization of evidence. Now outline of my talk, I'll start with a case-based scenario because our main aim was to talk to the practicing physicians. The patient will form the center of our talk. Then with that we'll form a clinical query. This work has become much simpler because Dr. Vaibhav has covered most of it. Then appraisal, some of the part Dr. Tukaram has covered. Areas specific to meta-analysis I will be stressing, and I will be ending the talk with some further reading. Now let us take this case scenario. We have a 45-year-old male patient who presents with rapidly progressive glomerulonephritis. Serum creatinine presentation is 5.5. Immediately started on dialysis. Then we do a renal biopsy and it is suggestive of ANCA-associated vasculitis. He started on methylprednisolone and oral cyclophosphamide as is the standard of treatment. There is no lung involvement, but we are see that there is no improvement. Now here comes the question whether to offer plasmapheresis for this patient or not. Though it is not very clear whether plasmapheresis should be offered or not here, so let's to involve the audience, how many would offer plasmapheresis and how many will not? And what do you think plasmapheresis is going to do for this patient? Should we take a vote? How many? Yes. How many say yes? Yes. How many say no? Okay. Now when we are looking at whether use of Plex or not, what are you trying to treat here? Whether are you trying to avoid dialysis for this patient, or are you trying to see to it that the patient does not die because of ANCA vasculitis? And these are the two things which most of the times we try to focus on. These are the positive outcomes which we are looking at. There are some harms which are usually neglected. Plex comes with its own problems. It's immunosuppressive therapy, so it will patient will develop serious infections. There are problems with Plex. Patient may have hypotension, which may increase the prolong the recovery from acute kidney injury. There are problems with access, problems with catheters. So there are multiple issues. So with this background, we can just jump and say we'll offer the newest and the expensive care available for the patient, or we analyze a systematic review. Now with that, we'll form a PICO, as Dr. Vaibhav has told. P refers to P patient, where we have a patient with ANCA-associated vasculitis. Intervention is Plex. Comparator is no Plex. And outcomes, first two outcomes were end-stage renal disease and death, which we are concerned with. The other one is harm, that is serious infection. Now there are many considerations when we are forming a PICO. We can make it more granular by involving age of the patient, severity of the disease, organ involvement, for example, if lungs are involved or not, and what is the creatinine at presentation, because some trials have shown that creatinine more than 5.5 at presentation is portends poor prognosis, better to not offer plasmapheresis in those cases, and whether the patient was dialysis dependent at presentation or not. These are some of the points which we take into consideration when we form a PICO. And outcomes also, when is the outcome measured? Sometimes outcome can be measured at 1 month, 6 months or 12 months. We have to have a patient important outcome. So for the purpose of discussion, we'll consider a time frame of 12 months here. Now with this PICO, we use Dr. Vaibhav's method and do a search and find a systematic review and meta-analysis. which was published in BMJ 2022. The first author here is Dr. Walsh. He is the one who has done a trial on ANCA-associated vasculitis with around, yes, with around 600 patients, largest trial in this one. So, now what's the difference between systematic review and meta-analysis? Systematic review refers to collecting, evaluating and synthesizing evidence on a clinical query. It is just collection of trials published in that particular area. Meta-analysis refers to the statistical part of the systematic review, wherein we take up each study and see what is the outcome of that particular study, group it up, then make a pooled analysis. That is called as meta-analysis. So it is possible to do systematic review without doing a meta-analysis.